All right, welcome back. Now, the annual Africa Health Exhibition and Congress started yesterday and will end on Thursday, that's tomorrow, at Gallagher Convention Centre in Johannesburg. It hosts health and medical experts from South Africa and abroad and looks to engage attendees on the latest information and innovation that's available. Well, to tell us more, we are joined in studio by Dave Panther, who is the sales director at the Informa Life exhibition. Good to have you.
Good morning, thank you very much.
Absolute pleasure. So this exhibition, it's in its 5th year. Just tell us a little bit more about what it is that it does.
Yeah, I mean, obviously we launched 2011 and it's been an interesting development across the past 5 years, working with associations, the hospitals, the government to try to understand how we can help to educate healthcare professionals and show latest innovations, technologies, and bring the international community to the region.
Yeah, well, I see that the actual theme this year is particularly focused on driving healthcare on the continent. Let's talk about that. I mean, in terms of access to proper and adequate healthcare in Africa, it is a very challenging issue. Sure.
I mean, obviously with lots of rural healthcare being an issue here, I think the important thing is the public-private partnerships, and then obviously the government working with the commercial entities to try to bring access to healthcare to the population across the region. So that's very important.
Access to healthcare, is that possibly the biggest challenge?
Yeah, I mean, absolutely. With access to healthcare, it's meaning that making sure patients can actually get regular medical checkups early, so they can prevent any diseases developing into many more serious cases. So I think it's all about early detection. But also then it's making sure the cost of healthcare is also brought down by increasing the scale, I think, as well.
Yeah, I mean, when you look at some of the other challenges, we talk about the cost of healthcare, we talk about the access to healthcare. What else is it? I mean, what really plagues healthcare in Africa?
Obviously the infectious diseases are a very key part, and we're coming out of the Ebola crisis and what's been learned from that and how to reduce the infection rates and obviously then stop the spread of the disease. So we're able to focus on, say, the public health and look at infection control, what needs to be done to then help patients not get any disease or communicable diseases in that way.
Yeah. So. Yeah, I mean, we talk about Ebola and you say coming out of it, but I mean, are we really coming out of it?
I think it's important that these infectious diseases are always going to continue to be looked to be a problem for many regions across the world. So it's how you deal with the crisis and the infection. So obviously reduce the rates and make sure that lesser patients don't get spread of the disease.
Yeah, indeed. All right, let's look at South Africa now, because obviously being a part of the African continent, we'd have to measure ourselves and our performance. From what you see, from what you know, how does South Africa rank?
Very, very much up there with the rest of the world. I mean, I think there's so many key doctors and healthcare professionals coming from the region. We're obviously working with European and American and Asian hospitals to showcase what's happening over here, and actually taking examples of treatment of disease and how in South Africa being looked after, taking their examples worldwide as well.
Are you talking about the public healthcare sector or the private?
Possibly more on the private side, because obviously we do have some big private groups which are now operating internationally. So like the Medcare group, for example, who operate internationally.
Yeah, so it's more looking at that and the developments that they are bringing on.
Sure, yeah.
But I suppose it's the improvement in where the majority of citizens in Africa do experience and get the public health care, which I suppose needs to be worked on.
Sure, absolutely. I mean, I think it's important that everyone works together to develop a healthcare system. So, your doctor should be there for you all times, not just when you're sick, but it's how you see people regularly, have the checkups, and again, say primary care is massively important because it helps prevent further illnesses, complications in later stages. If
we have to look into the future of what the South African medical, well, not South Africa, but just healthcare on the continent would look like, where are we trying to go? I mean, what is the aim?
What is it? I mean, obviously, it's very key that technology is helping to make things easier for patients, but also it's also for the healthcare professionals themselves. So how they treat their patients, how they are able to understand what diseases are prevalent, what the treatment patterns are, and obviously them being able to just educate people better, so that they are conscious about their health their lifestyle. Lifestyle is massively important, and it's all contributory to what happens in the future.
Yeah. Okay. Just wrapping it up a bit here. Annual healthcare, the Africa Health Exhibition and Congress. What is it all about in terms of who's going to be there, what's on display, some countries that are represented?
Yeah, absolutely. I mean, obviously, primarily we're looking at the education side of it. So we've got 13 conferences looking at various clinical aspects. So we've got doctors, nurses, technicians from across the region who are attending that. On the business side, we've got I think almost 500 exhibitors. We've got representation from about 13 or 15 countries, and international pavilions from Germany, the UK, Korea, China, Taiwan, and that's increased over the past 5 years. So it shows how important the region is for the international market, healthcare sector as well.
Good. All right. Well, good luck with it. Thanks for coming in and chatting to us, Dave Panther, who is from the Africa Health Exhibition and Congress that started yesterday. It's set to end tomorrow at Gallagher Convention Centre. Thank you very, very much.
Thank you very much.
All right. Let's take a break. We'll see you after this.